Hello and welcome back to Ask Dr. Moore. Today I am fielding a patient question, and this one's really interesting. Here goes. I got a tendon transfer operation because of drop foot. Now my ankle is pretty good, but my big toe is not so good. It just comes to a straight position. Is there an operation that can help my big toe lifting and strengthening? And the answer is never say never. There are incredible procedures that are happening out there and different ones that we morph and change to the patient's needs. But the main one called a tendon transfer is what happens when drop foot, which affects the front of the leg. The front of the leg has the muscles, of course, that pulls the foot upwards. And then behind the leg, the main one is Achilles, which pushes the foot downwards. These are unaffected. So, of course, these win out. So the foot's dropped down like that, patient hits, they can't lift it up and clear the ground, hence drop foot, the name. What we do is we try to take the overloaded area, which is the Achilles and flexor tendons. Now, flexor tendons are just underneath the Achilles and they go down underneath the inside ankle joint here. Then they come underneath the foot down here and they flex the toes downwards. Well, you don't need all of them. So we'll take one or a few of these slips and redirect them in the back of the ankle. And then in this space here, you can feed the tendon from the back to the front and then hook it right here. So initially the brain's confused because when you push down, your foot comes up, but it readjusts over time. The patient can clear. Unfortunately, the extensors that are on top of these lesser toes here that pull the toes up, there's an individual one for the big toe joint called extensor hallucis longus, and that one is, we either have to reroute that one on its own and take the slip and pull it over here, take the tendon and split it into different areas where you're anchored in the front, and then maybe take one more and pull it over here on top of the toe. Or you can just wear it straight, fuse the joint. Sometimes we fuse the joint because it does take a beating without balancing tendons, and then you don't have to worry about it. It's kind of angled up in the air. You hit the ground and then push off. So there's several different ways of doing it. Not too many people will spare a second tendon slip and then pull it into this extensor tendon called the adjust for the big toe joint. It can be done. It's rare. I'm not sure if it will be worth it. You'd have to consult with your surgeon, weigh your risks on this one. But hopefully that was helpful for you. And if there are any other questions or you're interested in FAQs or frequently asked questions, there's more of them on my YouTube channel or the Ask Dr. Moore channel. Again, thanks for tuning in. Stay healthy and one step ahead.